Welcome to today's seminar. Today we talk about the benefits of standing with power wheelchairs. This course should help you writing the letter of medical necessity or motivating the demand to the reimbursement agency. Standing offers a broad range of benefits to the user. They can be classified in clinical benefits, preventing secondary complications or facilitating physiological functions. Standing also offers psychosocial benefits and functional benefits for the user. The first topic we want to talk about is the prevention of contractures and spasticity. In a standing position, certain groups of muscles are stretched. These groups of muscles are the hip flexors, the knee flexors and the plantar flexors. Stretching muscles is known to have a positive contribution on the range of motion in joints and to prevent contractures. At the same time, stretching muscles is known to reduce increased muscle tone and spasticity. The effect of muscle stretch is limited in time and it needs repetition as much as possible. A standing wheelchair facilitates the independent execution of exercises for muscle stretch, without the need for a cumbersome transfer to a standing device. The integration of standing exercises in activities of the daily living further facilitates the repetition of stretch exercise. Standing also can have a positive impact on the bone health of the user. It is important to understand that in the bone remodeling process there are three components very important. The first component is the axial or the gravitational load. The second component is shocks. The third component is muscle stress. In standing exercises with a power wheelchair, only the gravitational or axial load is applied. The muscle stress and the shocks are not present. Therefore, it is wrong to believe that standing will prevent osteoporosis. The benefits of standing on bone health need to be diversified in diagnosed groups and in age. In individuals diagnosed with spinal cord injuries, early intervention of standing exercises has shown to contribute to a less severe degree of bone loss. In individuals diagnosed with cerebral palsy, standing has shown to contribute to better bone health in the lower lumbar vertebrae. In the group with pediatric users, standing exercises have shown to help them to have a higher peak of bone mass at the age of 25 to 30 years old. In this group, standing has helped to build the total bone mass and to prevent spontaneous fractures. A third benefit is the prevention of pressure injuries. Standing has shown to be very effective as an offloading exercise. During the standing exercise, the pelvic area is fully offloaded, reducing the risk for pressure injuries. Standing also helps to decrease the temperature at the seat interface, and an increased temperature has shown to be an extrinsic risk factor. Keep in mind that the current guidelines indicate that frequent repositioning is necessary. Depending on the risk, 2 to 4 times per hour for at least 2 minutes. Standing also has shown to be beneficial for the circulatory function. During the standing exercise, the heart rate of the user is increased. Prolonged sitting can cause edema as a symptom, but with chronic venous insufficiency as an underlying diagnosis. Individuals with the diagnosis of chronic venous insufficiency have an increased risk for a thromboembolism. Regular standing can contribute to the improvement of venous return and to reduce the risk for chronic venous insufficiency. The standing position also has a positive impact on the respiratory function. The respiratory function involves two types of muscles. The first one is the diaphragm. The second one are the intercostal muscles. Many of our users have impaired intercostal muscle function. They rely on the diaphragm for their inhalation. In a seated position, a deep translation of the diaphragm is hampered. This leads to reduced ability to cough. The standing position facilitates a deeper translation of the diaphragm, which can contribute to an improvement of the cough function. Improvement of the mental function and reducing pain is also frequently reported as benefits of standing. On average, 2/3 of the individuals report to feel healthier after standing exercises. This indicates that standing has a psychological impact. An increase of the individual's well-being and quality of life is also frequently reported, as well as a reduction in pain after the execution of standing exercises. Prolonged sitting without changing the angle of the hip has a strong correlation with increased discomfort, pain, and a reduced sitting tolerance. Standing exercises will change the hip angle of the user, contributing to an improvement of sitting tolerance. In a standing position, the gravitational force applies a pressure on the waste material present in the bowel, and this pressure happens on the sphincter. This creates a natural urge to go to the toilet. In a seated position, the intra-abdominal pressure can be slightly increased, having a negative impact on the peristaltism of the bowel and increasing the transit time. With an increased transit time, more water is extracted from the waste material in the colon, which increases also the risk for constipation. Frequent opening of the hip angle with position changes such as standing can positively contribute to the peristaltism and the transit time, reducing the risk for constipation. Research also suggests that standing can improve the bladder function and can decrease the risk for urinary tract infections and can reduce the prevalence of renal and bladder stones. Standing with power wheelchair also has a strong correlation with improved functional and participation outcomes. Research in individuals with stroke has shown a positive trend in the gross motor function, in trunk control and balance. Standing can also improve the functional reach, enabling activities of daily living and self-care. Standing can support the user to gain and/or maintain employment. The positive influence of standing on spasticity can enable safer, independent transfers. A standing wheelchair can facilitate users to reach a satisfying level of independence and participation in non-adapted environments. Standing also has shown to potentially improve the psychosocial outcomes. The human being is designed to be able to stand, and the most of our daily activities are concentrated around this position. We stand at home, at work, or when having a conversation, to name a few examples. Being able to stand is often considered as a part of an active lifestyle, and the enabling of increased participation and independence in daily life improves the self-confidence and self-awareness of the users. Standing enables users to interact at peer level, lowering the burden to interact. At the same time, with the improved respiratory capabilities, the user is capable of speaking longer and louder. The combination of medical, functional and psychosocial benefits of standing positively influences a person's well-being and self-esteem, resulting in an overall improvement of quality of life. Thank you for participating in today's seminar. I hope this seminar brought you some new insights into the benefits of standing with power wheelchairs. We hope to see you in one of our next seminars.